Hi, everyone. And y'all know Brandi, and we're going to be talking about how swimming the water helps her. Because a lot of us, this is recommended as the best exercise for those of us with brain injury, regardless of type. And she's obviously doing this on her phone. So we're going to she's going to show us the pool, get in the water, and then we'll talk a little bit about, swimming and water activities. So, hey, Brandi, how you doing?
I'm good, Mark. How are you?
I'm okay. So I'll let you, just share, you know.
Well, I recently had three surgeries. I had heart surgery, two lung surgeries,
Mhm,
and then was Baker acted.
mhm,
Didn't sleep for 5 days because I developed PTSD from the hospital and I was scared.
mhm,
Um, which I think anybody would if you have three surgery. Like two of them are awake, by the way. I had two chest tubes. The first one was about this. Second one was about that big inside
mhm,
of my chest into my lung. And I could actually see the nurse pry my skin open and my ribs
mhm.
open to get the tube in.
Yeah,
And I was trying from this. I think anybody would be. It's very difficult, but I'm starting to find peace. I'm looking for a therapist and a neuropsychiatrist to help me get through this, and possibly a therapist that could recommend ketamine therapy to me.
mhm.
I'm very interested in that rather than the typical Western medicine. I'd rather try something a little bit more natural, maybe, or from the earth. I don't know. I guess I'm looking for something a little different. Let's just put it that way. I'm a medical marijuana patient. Um, I microdose mushrooms, DMT. It helps me tremendously. I suffered from long-term COVID as well. And the medical doctors out here in Florida, they're not the best. I don't know how else to say that, unfortunately. It just seems like they don't care out here for some reason. I'm not sure if it's just because there's a lot of older people that annoy them, or someone like me with a brain injury that gets misdiagnosed as schizophrenic, which I'm definitely not. I have mild depression, mild anxiety. Actually, my anxiety is almost completely depleted in a weird way. I think the DMT is for me. And I'm just really looking for something like a physical outlet because I can't ever relax, man. My
Mhm.
brain keep going and going. I'm grounding myself too more. I bought a grounding mat and grounding shoes. Um, I'm just trying to find myself because of all the abuse that I have gone through in my entire life. Um, it's been tremendous, and no one should have to go through that. No man has the right to touch a woman ever, they do not want it. It's called respect. We all need
I think,
that.
well, let me be clear. No person has the right to touch another because men are victims of abuse too.
Oh, 100%.
So
Yes.
no person has the right to lay hands on another ever without consent.
Children. I mean, with children, just a smack or grounding them and them not completely understanding why they're being punished. If you don't fully explain it to them, that's traumatizing.
And this applies to adult with adult and adult with child. Laying hands on another person especially out of anger or a vengeful sense.
And I've
And
dealt
yeah,
I dealt with that at the hospital I was Baker acted because I was delusional. I was delirious. I was suffering from delirium.
mhm.
And I mean, if you don't sleep for 5+ days, what do you expect?
Well,
I was
with custodial issues and imprisonment and stuff like that, or holding, it becomes complex because it's like you
I
need to
got
protect people and
it.
stuff like that. All right. Yeah, but that's a whole other topic. And we can talk about that otherwise. Could you show us around the pool? And because this would be a different episode. Could you show us
Yeah.
around and what you do and stuff like that? Because we did say
Well,
we
this
were
is
going to
my
talk about it.
pool right here.
Very nice.
They got like little chairs you can sit and
Mhm.
enjoy the sun.
Which is
And then
awesome.
it starts out at 3 feet and then it goes all the way to I think 5 feet, but it's a little bit more, I'm not gonna lie. I mean, I'm 5 foot, I mean it's a little less, I should say. I'm 5 foot, no, a little bit more. I'm 5'1", and it kind of goes over my head. So I was
Okay.
like, oh, this is a little fuller than normal. So it must have rained. And then you can have parties here and stuff. Um, you have refrigerators, places to chill. There's a fireplace over there. And yeah, this is where I live. I live in an apartment,
Very
a two.
nice.
Yeah. And then the gym is right there.
Okay.
So after I enjoy the pool today, I'm gonna dry off and then I'm gonna go to the gym with my friend Marcos.
Okay.
Yeah. Hold on 1 second, Mark. Let me flip it back over to me. All right. But
Okay.
yeah, I came here to go swim today and I wanted to call you and talk about it
All
because
right.
I very therapeutic.
All right. So can we then hit the water and talk a little bit?
Yeah. All right. Hold on 1 second. Let me get my bag so that I can set up the camera for you. Get
All
my
right.
I like my hat on because it kind of keeps the
Yeah.
sun out. Too bad I may have ruined this hat by getting it wet, but that's okay. I'll just have to buy another one, right, Mark?
Mm,
1 second. This will be my pool hat and my pool glasses.
yeah.
Hold on 1 second. Sorry, I got my pockets full. Should have been a little bit more prepared. Gotta take my shirt off. All right. It's a little cold, but but yeah, the water calms me. I don't know
Mm,
how.
definitely.
1 second. Let me get my head wet real quick. Because I suffer adult ADHD.
This
Which,
executive syndrome is the neuros call, as neurologists and neuroscientists call it, because the psychiatrists say you can't call it adult ADD or adult onset ADD unless you had it as a kid. But it's like, okay, whatever.
but you know what? I could have had it as a child, and it may have never been diagnosed. I didn't see a therapist at all. That was kind of frowned
Right.
upon.
Yeah. Oh yeah. Yeah. I know that. It's like, um, so what do you find is like ways that physically and mentally that being in the water helps? Things you do,
Uh,
what you find helps.
well, I like to kind of jog in the water, like I'm
Mm,
jogging, and I like close my eyes, and I
okay.
imagine hiking, say in Utah or Colorado, up a
Right.
mountain.
Okay.
Because I know I really cannot do that right now,
Right.
but in my mind I can.
Right.
In my
Of
mind
course.
I want to. I'm my own avatar.
Right. Do you?
And there's something about that, like, Steven Spielberg and all the movies, like you look at that stuff in Disney and you're like, oh my God,
Mm,
little children at heart.
right.
That's all we are, and I think some people frown upon that that child side.
Mm,
We but we need to learn to embrace it more. It's
right.
there. Embrace it. Love it. There's nothing wrong with it. Like when I go to Disney, I'm like a little kid. Or when I go to Universal Studios, we went there this past weekend. I was like a little kid at the candy shop. I just wanted to buy and play with everything, and I had to calm
Right.
my down. I was like, "Look, Brandy, you don't have money for this shit. You're literally you have a GoFundMe set up because you literally don't have money.
Right.
So calm down
Right.
and think before you do."
Right.
And I didn't realize. at first I was going through this, like I had to relearn everything and it was frustrating for me. So I acted out. I didn't want, I guess, dementia and Alzheimer's really scare me because it runs in my family. So I try to block that, like I don't want that.
Well, I don't think anyone wants that. I mean,
Exactly.
and there is a difference between,
Sorry. I know what it was. There's ants.
that piece. I apologize. I mean, it's kind of like, there you go. You're perfect right there. Sorry about that. So, well, yeah, and I think the important thing is to embrace that. You say you feel kind of like a kid or something like that. I think it's really important to embrace some of that. It's like, um, and a lot of us have some of that after our brain injuries. Is like we're more impulsive, we're more open-hearted, and I really like that. That's one of the things because, as adults, we're told don't do that, and all this thing. But I really like that. And I like being with people who are, become more open. Kate talks about in one of the videos we have about, how does she put it? She says, well, with benefits of brain injuries, being more open, not being as uptight or anxious, or trying to impress people or whatever else, just being you. And I like
Not I feel like there's no other way to be. You have to be yourself. Like right now I'm hot. Why would sit here and suffer hot for a video? I'm just gonna fall back real quick and now I'm gonna come back.
that. Yeah, I like
See?
that. Yep, absolutely. And, it's like,
Right?
yeah,
But to me, oh, that was fun.
yeah. And
Why
the
that?
rule, the rule, at least as far as I'm concerned, always is as long as it doesn't harm anyone else or interfere with, is as the one justice said in the Supreme Court, and I'm a believer in this one, it is, your rights end where others begin. As long as we always remember that,
Yeah.
be you. And other people are so busy trying to like push everyone aside, just me, only me. As long as we maintain that healthy balance, as long as we don't do that too often, as long
Yeah.
as we try to find that harmony. I mean, you're good at that, and it's like, it's one of the reasons I care about you so much is like you have that kind of open heartedness, but are a caring person. And so is everyone else in the company. It's like why I consider them my family. They're open hearted and, they care. And that's what's important. We find a family. And that's a struggle for a lot of us with brain injury. And, it's like what you're talking about with the physicians and stuff. Um, a lot of them don't understand brain injury. It's like if you people with brain injury don't easily fit into that box. We have a lot of things in common with different disorders, but it's not exactly the same, you know?
Yeah. Sorry, I live in Florida. It's hot.
Yeah, no, I understand that. But, it's like, so what other things do you do water wise to help you?
I like to when I'm standing like this in about 3 feet water, I like to jog like this. And then when I'm doing, I like to close my eyes because when I
Mhm.
close anywhere, like
Right.
I'm in Colorado climbing a mountain.
Mhm.
You're watching me look like a fool in a pool
Yeah.
running by herself. No one else is here. But in reality, in my head, I'm in a happy place.
Right. I mean, we could edit that, put something in the background, but it still isn't the same.
Yes. All you have to do is close your eyes to go there. Life is
Mhm.
difficult in a way that we like to take that magic out. And why? It, it shouldn't just be for children. Like I watched The Little Mermaid, the new one, yesterday.
Okay.
Yeah. And I was like, oh my God, I love every second of this. I am Ariel because I don't know if you know me very well, but about a month and a half ago, before my heart surgery, I couldn't walk. I could not lift my legs. I don't know if you can see this right now,
Yeah.
but I can lift my legs.
Hmm.
I don't know what happened to me. When I had my heart surgery and everything, I did the PTSD
Hmm.
and my brain has reversed. I'm more artistic now. I can't read or write. Um, that's why I do video. And I know it could get tad annoying, But that's the only way I could truly communicate.
No, I mean,
And
for me, I prefer it. I can read and write. However, I don't communicate it well. And to be honest, most people with brain injury, most of us, although we can, it's like, when we relearn reading, writing, things like that, we're just not as good with the pragmatics. And the pragmatics is use of the language, like conveying our intent and stuff like that. We really do very bad with it. And we hurt people in the process of trying to communicate. It isn't intentional, but we may not understand how things fit together, mean the other meanings of words, double entendre, irony, jokes, stuff like that. And so we end up stepping on people hurtfully, and we think we're just being honest. And usually it's not that simple. And so it's doing videos and stuff. I definitely prefer conveying in that mode, so you could see expressions, or you can see, you know, the intended sincerity, as opposed to the problems with typing and oops. I mean, it's hard enough for neuronormies, as I call them, to understand the written word, and many times they mess up that way. It's even harder for us.
it's even hard for me to have conversations like this right now. Like,
Mhm.
as you right now, water and doing this, but I'm still listening, but I'm not
Right,
grasping it. And it's because I, with ADHD, I cannot control it. I just start doing things. And
right.
I bought this ring, and I
Yeah.
don't know if you hear it. When I do this,
Oh, a fidget spinner.
yes, it calms me.
Right, it's a
So,
fidget spinner.
yep, it's a fidget spinner. So when I go into the grocery store or something, I keep my headphones on me. Um, if you see
Right.
me now, I'm not being douchey.
No,
Where I have the headphones, because
cut down
they're
on the noise and the distraction. Yeah.
they're noise, and with noise canceling headphones, I can focus. I
Mm-hmm.
think that's why children are constantly playing with their iPads, their phones. It's because we're not giving them the attention that we used to have, where we go outside and play as children.
And I think that is a critical point. And we expect them to be able to have adult attention spans and focus. They don't. And those areas, and we've discussed this when it comes to dysexecutive syndrome. The problems and kids with brain injury do generally worse because their brains still are not fully developed. And this is a serious problem. And most of us with traumatic brain injury, we do have trouble with um, executive function language. I have trouble with it pretty bad. I use medication to help me. You've heard Kate talk about it.
What kind
All
of,
of us do. Kimmy, all of us, huh?
I'm interested in the medication. Would you message that to me?
Yeah, sure. Sure. But
Sorry.
it's the same medications that are used for kids with ADD, ADHD, or adults with, you know, these stimulant meds are typical. You need to, all these things you need to handle slowly because they are what they are. They're high risk, but
Yeah. Sorry, Mark.
no, 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 that's fine.
Like I said, it's really hot out here.
No, I understand.
Be right.
And I'm glad you're willing to do this, because I was going to ask you if you do other pool videos with us, maybe like exercising with you or other stuff,
Oh,
you know.
absolutely. Love that.
And but it is important for us to, talk about like how water helps, and how, again, what you have is common to anyone with acquired brain injury of any sort, not just TBI, but chemical exposure, or if your heart stops, full cardiac arrest. Julie talks about this. She has problems after her cardiac arrest. Everybody. I was talking with somebody who had brain damage from hyperthermia, who has had heat stroke, really bad heat stroke. That can do it. Any kind of environmental exposure, drowning can cause brain injury. Of course, lightning strike, high
A
voltage electrical shock.
chest tube, two chest tubes being put in your lung and not having proper oxygen.
Long
Um,
enough, long enough, it does. I mentioned that in one of my videos about low oxygen levels. Hypoglycemia, long periods of low blood sugar. This is why it is important to control your blood sugar well. and not to go without a meal if you gave yourself an insulin shot, low blood sugar long enough. There's some evidence that protracted migraines can cause brain injury, and that because it affects brain circulation.
Sorry, I'm realizing right now as I'm in the pool, this is where I think as well.
Yeah.
When I put in there, I was with low oxygen for a few days and struggling with air. And
how low?
I mean, it wasn't that bad. It was like 98, but I was struggling.
That's within range, but if you were having problems breathing, that's still something that needs to. I'm talking about below 90. I'm talking about like 85%.
Well, I did at 80%. One point.
How long?
Yeah, when my lung collapsed, I got to that, and they didn't believe me.
How long were you like that?
For a few days.
85% and below?
Yeah. Well, that it was only that for a day when my lung actually fully collapsed, and then.
Yeah, well, I don't know. You need to talk to a specialist in that condition, in dealing with hypoxic brain injury and stuff, to get more information. Because I don't see your records, and I can't give and will never give like outright medical advice here.
Would you be able to, so that I could look at myself?
You're welcome to look at the video that I have where I talk about anoxia and hypoxemia, and I'll gladly share it at anyone who's interested, because I think that's important to understand. But there are all kinds of things that can cause brain injury. We're just learning a lot of this now. It's fairly new information as to like viruses and bacteria, bacterial infections, sepsis, COVID-19, even the flu. We're learning like bog variety flus and colds.
Because you're coughing and you're not getting enough air.
Well, more than that, they also attack the blood-brain barrier and it can directly kill brain cells. These are things we're just starting to discover how vulnerable the brain is. We used to think things were a lot more resilient. I mean, the old TV shows and stuff that are funny, where it's like after some kid gets hit in the head with a baseball, how many fingers am I holding? Who's the president? All right, let's go. Like from the Sandlot and stuff like that. But it's like
my brother played football. I was a little cheerleader.
Oh yeah, yeah, and that cheerleading is one of the leading causes of traumatic brain injury in women, girls, like stuff like that. And football, we all know how bad that is for repeated knocks to the head. And there's evidence that minor traumatic brain injury that's repetitive causes more damage over the long run than one or two severe traumatic brain injuries. This is all new research.
That's why we need to be more cautious of our children, so that when they are playing these sports, we give them the proper helmet, apparel, like knee pads and everything. Because
when my discussion with Blake, the helmet itself prevents skull fractures, but does not prevent concussive blows, because the brain shakes inside the skull, even with a helmet on it. And so it may not be sufficient to prevent brain injury.
What if you brake too hard, too fast? Like a minor brake could make someone go like this.
Well, that's not well explored. But if you stop fast enough, yes, that may do some tissue damage. That is not understood. That is really not well researched, but it's certainly a possibility. Don't know. We did not evolve to go 60, 70, 100 miles an hour. We did not, it's like
relax, try to find food and make family.
But we certainly did not, develop. We were meant to go the slow speeds that, our bodies walk or jog at, not to go super fast. This is why people still have symptoms after getting into a car accident. And even people that I have a video about this with GCS at 15, 2 weeks later, they test them and there's loss of white matter. They think they're fine with the GCS at 15 and their symptoms pop up like 2 weeks later, dysexecutive type syndrome.
Even when I'm in the gym, I see these guys that will grab the 25, 30, 50 pounders. And I'm like, why are you killing your body when you just grab a 5-pounder and just do that motion? Even like I was doing Tai Chi last night to try to calm myself so I could sleep. I've never done Tai Chi before, by the way, so I probably look ridiculous. But Tai Chi, it's like an energy force, and you just want to bring that energy to you or away from you. you
You
know?
know,
I
medically
find
speaking, it's
relaxing.
like I
Cool.
can't say anything as that hasn't, and I won't talk about stuff too much that hasn't been researched or at least not supported by evidence. So I don't know
Yes.
if they haven't said, but maybe these are all things that are either fodder for research, for us to dig into, or that there's some studies that say yes or no. And so, you know,
I think
I
more. Like, I would be willing if a doctor was willing to just take me in for like a week or two
mm,
and talk to me, like, and be a good doctor, not these assholes I've done out here. Sorry, excuse my French, but someone that really is interested in brain injuries and wants to know what's going on with our brains, I would totally be willing to do that.
mm.
You know,
There are a lot of case studies. The problem is you need large numbers of people in order to make a thorough study, and that's difficult, really.
well, if
Um,
you think about all these people that are angry in the traffic, they're slamming, going, slamming, going.
yeah, I know. That would need a large number of people. You'd probably need to run it over a couple of years. You need to start with neuropsychological tests on people in rural and urban areas, young people without any head injuries of any sorts and stuff like that, and maybe follow them over like 5 or 10 years and just see whether, and any person who suffers a head injury outright would have to be eliminated. If you have any kind of brain injury, you're out of the study. You need to study like 10 or 20,000 people and see whether just like those kind of traffic, incidents do cause that. I don't
Yeah.
know. I'm willing to bet because they did study some young football players who did not suffer any head injuries, but just the tackling and the practice and stuff like that did show a general degradation of performance. And these are people who are just running and
Yeah.
smacking into each other and stuff. And
Someone
so
that
that,
really is Mike Tyson and Kanye West. All these people think they're crazy. They suffer from brain injuries. Kanye West was in a
yeah, yeah,
horrible.
no. We know that CTE, that this causes, how much damage this causes. That's already a known element. Well, what we're talking about is does just living, driving the way we do, and sudden hits and stuff like that, is that a cumulative effect? Don't know.
Well, it's
Really.
like out here in Florida. I don't know if anybody else lives in Florida. You know what I
Oh,
four is,
about
especially if.
20 million people,
Oh my God, I
but
live
with
by.
brain injury,
I live by Disney. And
lots.
well, what do you expect? I'm constantly stopping, going, stopping, going, stopping, going. I'm like, oh my God, this
The
traffic is
the answer
terrible.
is we don't know. That's what the answer is. We don't know.
Yeah,
Um,
and I black
and
out of nowhere. I black out for a while and then I come back. I don't know how else to explain it. And
well,
that's what CTE is. We have blackouts.
but
We
the
don't,
thing is,
and we
and
say
the
in the
important thing
black.
is, well, are you having seizures? Are you having adynamic episodes? Is it
Well,
due to lack of oxygen or
yeah,
dysrhythmia? Could be a lot of things,
yeah, I'm not an epileptic.
but you
Um,
don't have to be. You can still have seizures without being an epileptic.
yes, exactly. And I got this tattoo right here on my wrist. I don't know if you guys can see it. Oh, sorry. It's a dime. Um,
Okay.
and my grandma always told me, when you see a dime, it's a pick it up, they'll look after you. And I was like, all right, I'll get a dime tattooed for you. So I have
I
grandma with
like
me.
that. That's cute.
Thank you. And so yeah, I got with the year that she was born. But
Oh, okay. That's neat.
getting it tattooed, I was telling this story to the guy tattooing,
I like that.
and I couldn't hear what he was saying anymore. All of a sudden, he was talking, but I couldn't hear him. And I was like, oh, this is strange. And I looked at him, I was like, I can't hear you. And he's like, what? And I was like, I can't hear you. So I kind of freaked out and I stood up really quick. And
Mhm.
then I blacked out. But they told me I had like a seizure, where I almost like um, my tongue or whatever. They put me on a couch to
Mhm.
try to, and then do.
About
And I was like,
15% to 20% of people with brain injury, regardless of whether it's traumatic or otherwise, have seizures. Now the question is, it's called they're post traumatic epilepsy (PTE). Now the thing is, Not all forms of seizures can be easily detected by an EEG because that looks at the surface of the brain. Some seizures happen deep down inside the brain, or deep brain seizures, and these need a special kind of electrode to pick them up. You need to place it deep in the brain to pick these up. And the best kind of doctor to turn to is called an epileptologist, and it's a subspecialty in neurology. But because not every neurologist is an epileptologist, they get a lot of training on seizures, but they are not specialists who only work with seizure patients.
I've never heard of this specialist. Would you be able to message me the specialist? I want to look it up.
Sure. An epileptologist has an extra year or two beyond their residency in seizure disorder. For my seizures, which I had after my brain injury, I needed to see an epileptologist to get my seizures under control. I tried just about 90% of the meds that were out there until I found something that worked for me. And my epileptologist was 90% of seizures to 95% can be controlled. It's just a matter of finding the right meds, or, maybe using a vagus nerve stimulator, some other device, deep brain, inhibitor that would work.
Now, can you have walking seizures where you're looking completely normal, but you're having a seizure?
I don't know. That's outside of my area of knowledge for that. You'd have to ask an epileptologist.
Yeah, I would definitely like to explore that, because I think
I do know there are absent seizures where you get really fast, like staring episodes. And adynamia is often confused with these staring episodes.
I stare.
Now the thing is, if nobody is home, and somebody's like, "Hey, are you okay?" and you don't feel like really tired after this or anything like that, it's just as likely you've had an adynamic kind of episode. And I talk about this a lot. And that is because you're stuck between inward thinking and outward problem solving. You're like stuck in this liminal space. I get these. Kate talks about this a bunch of, and that's not seizure. That is brain injury to the medial aspect of your frontal lobe. You're having trouble shifting gears. Your engine's on, but you're having trouble with the old gear shift. That's what that is. And unfortunately, there's not a whole lot to do about that. Some of us get them for hours, some of us just for a few seconds, and you need somebody else to kind of poke you to get you to shift and to move. It's tied into other, it is a disorder of consciousness, just a very brief, it's a pain in the butt. And there ain't much to do about it, even with the stimulant meds and stuff that I take. That's a pain. But yeah, you have it too, probably, and that's just a pain in the butt. And unfortunately, not a whole lot to do. Some of like I said, the stimulant meds can help a little bit, but it's just something you're stuck with.
Like, so drinking coffee or something like that might help this?
A tiny bit, but it's not something that can be cured. It's just something we're stuck with brain injury.
That's why I'm drinking so much Coca-Cola Classic. It's like I crave it. I can't go without it.
But no, that's something else. I don't know why, but it's like it can help a tiny bit, but it will not fix that symptom. That's not a curable one. It's just something you can maybe improve over time.
Like ginkgo.
I found nothing that fixes it, and none of my symptoms can be fixed. They just get better, over time. Time heals, practice heals, reinforcement heals, but nothing makes it go away completely. At least nothing I've found has made my symptoms go. They just get better.
Mark, for my brain injury, hold on one second, is ketamine. I want to try ketamine.
Well, you need to find a psychiatrist who will prescribe that for you. That's something you got to do a search for, a Google search. There are certain psychiatrists who prescribe it. It's helped people. Grace has talked about it with one of her videos. She uses it to help her, and she says it's helped her a lot.
Your view on hypnosis?
There's not a whole lot of research on it. I don't know. Some people with PTSD and other, emotional, like say it works. I don't know. That's one I'd have to defer. I don't know. Um, some people say it really does a lot. This is one of the, unfortunately, again, with brain injury, it's one of these things that you need to say, you know, and this is the truth for brain injury in general, because each one of us has our own pattern of symptoms. Certain things are pretty universal. A lot of other things are each individual. And so it's a matter of like asking people who've used or have these different symptoms and what they find works for them. So right now it's mostly a find people who found solutions that work for them. And this is why this channel exists, is to like share and, push out things that work for different people's symptoms. You and I have some symptoms in common. And, I'm glad to share what I know works for me, and you have some of your own unique symptoms. And so, you sharing what works for you to help other people. That's what this is all about. The hypnosis thing, I don't know enough about, and so I can't say yes or no. And again, research, as usual, for brain injury in general is, all
Yeah,
right.
sorry.
Yeah, we're kind of wrapping up, and so I do want to say thank you so much for sharing your experiences and for us getting a chance to talk. You have good insight, and as far as like things that work for you or good questions. So hopefully we'll see you again really soon.
Yeah.
And we'll do a pool one again, and because it's nice, and by the way, it's a very nice venue too. So
Oh, thanks. It's nice, Mark. Have a good one.
you too.
Bye.
Bye. Okay, and then that's where